Welcome to this explainer. Look, if you or someone you care about is staring down the barrel of shoulder surgery, you probably already know that the operation itself is really only step one. The actual work, that happens when you get back home. So today, we're going to break down some absolutely essential recovery memos compiled directly from top medical sources. We're talking the Mayo Clinic, the FDA, and the American Academy of Orthopaedic Surgeons. Our goal here is to help you confidently navigate everyday life after your surgery. We're not just throwing medical jargon at you today, we're translating these expert protocols into a highly practical, everyday survival guide.
All right, let's dive right into our roadmap for today. We'll be covering 3 distinct phases. First, surviving the shoulder immobilizer. Second, safe recovery meal prep. And third, your gradual exercise guide. It's a pretty straightforward path: rest, fuel, and rebuild.
Starting with Phase 1, surviving the shoulder immobilizer. For this restriction phase, we're relying on official Mayo Clinic guidance to truly understand your absolute most important post-op tool.
Let's get one thing straight right off the bat, because words really matter here. An immobilizer is not just some casual sling you pick up at the local drugstore. It is a secure medical device prescribed to strictly limit your arm movement. You see, during this critical initial healing phase, your surgically repaired tissues, whether we're talking about a rotator cuff or a full joint replacement, are incredibly fragile. The immobilizer acts as a mandatory restriction boundary for that vulnerable joint. Honestly, think of it less like an accessory and way more like a wearable cast. Its entire job is to literally prevent you from doing something by accident that could undo all of your surgeon's hard work.
And the fit here? It's everything. A proper fit ensures safe healing, whereas an improper fit directly risks your entire recovery. When it's fitted properly, your arm is fully supported right against your body, and your wrist is perfectly even. You feel securely locked in. On the flip side, with an improper fit, the joint moves freely, the arm sags, and this is a huge one. It causes massive neck strain. A poorly adjusted immobilizer isn't just annoying, it can actually pull on your cervical spine and cause terrible secondary pain, all while completely failing to protect your shoulder.
So, the crucial takeaway from the Mayo Clinic guidance is that strict compliance and comfort monitoring are your main jobs right now. You've got to keep that arm securely against your stomach. You absolutely do not remove the device without explicit permission from your doctor. And no, taking it off to just stretch it out a bit while watching a movie doesn't count. You have to ensure even support across all the straps. And here is a vastly overlooked detail. You must check daily for skin irritation. Wearing a heavy strap tightly against your torso 24/7 traps a lot of heat and moisture, so keeping your skin clean and dry is just a vital daily task.
Moving on to Phase 2, safe recovery meal prep. Your arm is secure, but eventually, your stomach is going to be empty. So let's talk about the kitchen, because surviving the surgery is one thing, but surviving lunchtime on a Tuesday? That's a completely different battle.
How exactly do you safely prep food with just one arm? It's probably going to be the most frustrating daily challenge you face. Chopping a slippery onion, trying to open a tightly sealed jar, moving a hot, heavy pan off the stove. These incredibly simple tasks suddenly turn into Herculean challenges. And unless you want your kitchen to look like a disaster zone, they're actually massive safety hazards.
To handle this, we're going to adapt to the FDA's core safe food handling protocols specifically for your recovery, so you can nourish yourself without risking illness. Those classic 4 steps, clean, separate, cook, and chill, take on a completely new meaning when you're effectively operating one-handed. Clean means setting up one-handed, pump-action soap dispensers before you ever leave for the hospital. Separate is vital because when you're clumsy with one hand, cross-contaminating raw chicken and fresh salad greens happens super easily. Cook means relying heavily on pre-chopped ingredients or slow cookers to avoid dangerous knife work. And chill means having easily accessible, lightweight storage containers ready to go so you aren't wrestling heavy glass bowls into the fridge. I really want to emphasize this concept. Adapting these FDA safety steps prevents foodborne illness right when your body's energy is desperately focused on healing. Think of your body's energy like a battery. Right now, almost all of that battery power is being redirected straight to your shoulder to manage inflammation, repair torn tissue, and rebuild muscle. If you accidentally give yourself food poisoning because you struggle to wash your hands or cross-contamination your counter, your immune system suddenly has to split its focus. A compromised body needs safe, high-quality fuel to handle the massive physical demands of recovery. Simply put, don't make your body fight a war on 2 fronts.
All right, Phase 3, your gradual exercise guide. You've protected the joint, you've fueled your body safely, and now it's finally time to start moving again for your physical comeback.
Using the official guidelines from the American Academy of Orthopaedic Surgeons, let's map out what this gradual return to motion actually looks like.
And spoiler alert, it starts incredibly slow. In week 1, you're doing what are called pendulum exercises. Now, this isn't lifting weights, this is literally leaning over and letting gravity gently swing your arm in tiny little circles just to prevent the joint from completely freezing up. By week 4, we move into active assistance, where you use your good arm, or maybe a prop like a stick, to help move the recovering arm. And then, way off in the future, we finally reach full strengthening. Remember, it's a marathon, not a sprint.
As this AOS protocol shows, consistency within these specific parameters is the absolute secret to safely restoring your range of motion. You cannot just wing physical therapy, right? If the protocol says to do pendulum swings for 10 reps 3 times a day, doing 50 reps all at once is not better. In fact, it's pretty dangerous. The reps and frequency are mathematically calculated to stress the healing tissue just enough to promote healthy growth, but not enough to cause a tear.
Let's pause on the number 4 for a second, because week 4 is basically a magic number in orthopedics. It is typically the critical milestone where you transition from purely passive resting into active assistance. Before week 4, your primary job is basically to do nothing and let the biology of your body stitch itself back together. But around week 4, the tissue is usually stable enough that if you don't start introducing deliberate, guided movement, you risk developing massive scar tissue and a severely frozen shoulder. Week 4 is where the entire mental game shifts from protect to progress.
To wrap up this explainer, I want to leave you with one final crucial thought. Your shoulder is healing, but is your environment actually ready for your recovery? As we've seen today from the Mayo Clinic, the FDA, and the AAOS, successfully bouncing back from this surgery requires way more than just having a great surgeon. Have you rearranged your kitchen? Have you bought that pump action soap? Do you know exactly how your immobilizer is supposed to fit? Preparing your daily environment before you ever step foot in the hospital is honestly just as critical to your success as the operation itself. So take these guidelines, get your space set up, and give your body the best possible runway to heal. Thanks for tuning in.